My name is Tracy Stevens, and I live in Kansas City.
Okie dokie. And so, obviously you have a professional connection with heart disease. Can you tell me a little bit about how that started and how you kind of got on that path?
I fell into cardiology, not in the direct, I want to be a cardiologist way. I was actually a physical therapist, and that was my undergraduate study at Mizzou. And I was a physical therapist at St. Luke's for a couple years. And actually at that time, if you were admitted with a heart attack, you stayed in the hospital for a whole week and you started inpatient cardiac rehab. And so as a physical therapist, I helped the cardiac rehab nurses with inpatient cardiac rehab. And I just fell in love with the physiology of cardiology and actually was starting to work on my PhD in exercise physiology. And my mom, my dad, my sister, brother-in-law, my boyfriend at the time, now my husband, were like, go back to med school. And so I went back to med school. I had a wonderful mentor, Dr. Ben McAllister, and so many of the colleagues there that just built my passion for cardiology and just seeing the whole spectrum from prevention to advanced heart failure and just all the potential that we can do to prevent heart disease and treat heart disease. And I think there's room for everyone to be a cardiologist because there's so much need and so many opportunities.
Very cool. And so do you have a personal connection with heart disease through your family or?
In our family or in my family, hypertension is very prevalent, and that's been a big passion of mine is raising awareness about hypertension. I feel it's the most neglected disease in our country, and it's the silent killer. And I think from that as a background, I would like to challenge every home in America to have a blood pressure cuff, because if we treat blood pressure, that reduces so much of America's diseases. And so I think just with my family history of having high blood pressure and just seeing what I've learned as a physical therapist, and it seems like a natural fit for me.
Do you mind if I ask how long have you been a cardiologist?
Over 18 years I've been a cardiologist.
That's
and
exciting.
So I've been at St. Luke's for almost 35 years, from PT student to physical therapist and resident.
That's amazing. Are there any stories, any patients who have kind of come through that have really stuck with you over the number of years, and you kind of look to as that on those hard days when you're kind of, why am I still doing this? Mm-hmm. Can you tell me one of those stories about somebody that's...
Oh, my career's been filled with so many stories about patients, and no matter what I learned in training and reading books, everything I do now is based on what my patients have molded me into, and sharing their experiences, learning about their symptoms, their stories, and that has helped so much in, I think, for all of us in the physicians we've become. And there are countless stories of that I can recall, so rewarding, heartbreaking, and to know that this is not a disease just for old people, and to see those younger ones where it wasn't lifestyle, and to see how they take on the world. Okay, this was handed to me, and to see how brave they are. They have taught me so many life lessons. And I think too, though, about, although we focus a lot on our patients, I think a story that really stands out in my memory is of families who have loved ones touched by heart disease, that it's the whole family that's been affected, and that we have to watch out for each other as a family. And I'll never forget a young lady who was caring for her husband who was affected by heart disease, and it required a lot of clinic visits. And like most of us as caretakers, we kind of forget about our own health. And in this scenario, this gentleman had profound heart failure, required frequent clinic visits. She would bring him in, not pay attention much to her health because her focus was on him. And she was having some indigestion symptoms, and family thought this is all, and she thought this was stress. And so her high school reunion was coming up, and the family said, "Don't worry, Mom, about Dad. We'll take care of him. Go to your reunion. Got her a hotel. Well, at the reunion, she never showed up. And they went to her hotel, and she had passed away in her bed. And she'd had a heart attack, and her indigestion symptoms were that of angina, blockages. But yet her focus was not on herself, it was on her spouse. So the caretaker's health takes a toll, and I've learned to really respect that. And so not only addressing my patients, but who's in the room with them too.
That's remarkable. So when you look at the future of heart disease in women, kind of what are your hopes? Where do you think we'll be, and where do you hope we'll be in the next 20 years?
I think in the future, in respect to women and heart health, there's going to be similarities, but I think we are going to be so much more empowered with research and the support of our community for research, the importance of the American Heart Association initiative with raising dollars for research. Because truly right now the way we practice medicine is based on white middle-aged male research. And to say this applies to women, yes, in some scenarios, but not always. And an area that I'm very excited about for women is young women who are born with congenital heart problems, that whereas they may not have survived their own disease, their surgical or their congenital heart problem was surgically corrected, and now we're seeing women, grown-up adults with congenital heart disease, they're wanting to have babies. Can they have babies? What's the risk that their baby's going to have a defect? I think we are going to be so much more knowledgeable in that arena than what we are right now. And to learn, are certain therapies more successful in women, certain medications? Devices, I think, will be a whole other issue. There's some mechanical hearts right now that are too big for small women. And maybe, I really feel, not maybe, but in the future, devices will be designed to fit small women, and that more women will be included in clinical trials and be represented in clinical trials as much as men.
Yeah, that's fantastic. Even with this, how far we've come, obviously, I learned this statistic this week that 7 times more women will die of heart disease than breast cancer. Mm-hmm. And yet, women still think of heart disease as that, chest gripping man, the Hollywood heart attack. Mm-hmm. Why is that? Why don't women know that heart disease is their number one killer yet?
It's been long coming that we've realized that women are at as much, if not greater, risk of heart disease than men, and it's much more likely, like you said, a woman will have heart disease or succumb to heart disease more so than all cancers. But not to discount the devastating diagnoses of cancer, but I think with heart disease, one, we weren't included in a lot of the research studies for various reasons. But I think, too, a lot of it simply is a visual. We can imagine ourselves without a breast or without breast. If we've had a heart attack, you can't see that I've had a heart attack. I mean, I truly feel if women's hearts were visible, we would take better care of them. And I think there's a disconnect in that, just the visual part. But I think that we're not aware of the statistic. We still don't understand the symptoms. We can have that Hollywood heart attack, but we can just simply be tired. And then we're stubborn. We show up to the emergency room, if we do, 4 hours later than men. And so I think there's a lot of reasons to explain. It's interesting. There was a study where they asked women if they thought they were having a heart attack, would they call 911? A significant number said no. I would wait to see if it got better. I don't want to bother anyone, and especially I don't want to be embarrassed when I get there that it's not my heart. But then if you ask that same woman, if your loved one, your colleague, was having a heart attack, would you call 911? 100% said, hell yes. And so what a disconnect there with that we won't call 911 for our own self, but you better bet we'll call it for a colleague. Mm-hmm. I'm Dr. Tracy Stevens, and I go red for my family, for my patients, and for this lovely community we live in. My family, my patients, my community are why.